guess we will do the next case and then we can conclude. So, and then the third case that's meant to be, we may do it with Dr. Sayed, I believe that we can do it next week. Okay. And because I think if it's more than 2 hours, it will be too much and the people will not be able to concentrate much. It will be too much information. Okay. The PowerPoints, I will try to find a solution to be attached to the YouTube channel. Okay. So there is a YouTube channel. I'm saying again, the YouTube channel, which is SCA Level Up, where all the recording will be there. So you can revise the recording then. And please, if you can subscribe, like, and share, that will be beneficial, please, for the other people to know about the channel and, spread the learning. Okay. We'll see. Yeah, so these are, uh, you can see the second case like that. Is it fine for you to me to scroll it? Yes, because I don't think that will be, I don't think I will be able to copy and paste all of that in
It's okay.
the, yeah.
That's fine. So I
Do
will
you want
just
me to
ask you.
increase? Yeah, for sure. Do you want me to increase the font size?
No, that's okay. I can see it.
Sure. So yeah, so can we start?
Right. So just can you scroll down?
Yeah, sure.
So she's on. Can you scroll it down further, please?
Mm.
Scroll it down further, please. So this. Scroll it down for me, please.
Sure.
Scroll it down further. Right. Stay here, please.
Sure.
Scroll it down, please.
I think there is no down. This is the last thing. You want me to bring it from the beginning?
Uh, yeah. Can I have a look at the
Blood?
test piece? Bloods, yeah.
Yeah.
Can you go down, please? Further down. Further down, please. Right, ready to start.
Before starting, I just want you to tell me what you was thinking in these 3 minutes.
Yeah, so I was basically trying to prepare my battle plan.
Okay,
Uh, Honestly, I didn't prepare any battle plan. I just wanted to read really well what is given
okay,
to me. So I just picked one important bit that this appointment is for blood test results. So
okay,
wanted to pick any abnormality in the blood results.
okay,
And on my whiteboard, I have only written that his cholesterol was high,
okay.
and apart from that, I think everything looked normal. There was two areas which you highlighted, but they looked normal to me. So uh, my impression is nothing in the blood tests.
No, there is. Okay, so yeah. So first, you can see that yeah, this is appointment for revision of a blood test, and then
Mm,
blood test revision needs to tackle it in different way than any other case scenario. So blood tests. So you need first to ask the patient, does he know why we did the blood
yes,
test? Yeah,
that
and
that
they
was
have any
definitely.
expectation for it, okay? And
Mm,
then you may deliver it, and then especially if there is no alarming things there, you can deliver it and then ask him again about his eyes because you will deliver the possible diagnosis. And then you will need to check his eyes again, and then you return to the usual structure, okay? So these are the difference, the bit that is different in sorry, because the laptop will just battery will just go 1 minute. So that's the bit of difference between the case and the non-result case. And then
mhm,
you can see that the patient have multiple chronic disease. Is it, is it something related to his blood tests, having blood tests, is this is can be affected by any of these chronic disease or not? And
mhm,
the other thing, why he had the blood test, it may be written there because they said the clinical pharmacist, so maybe this is a medication review. Can the pharmacist the medication is affecting him? And the other thing, you will need to ask about the compliance, isn't it? Yeah, the compliance of
mhm,
the patient of his medication because he's chronic disease, and then how this affecting his mental health as well.
mhm,
Coming back to the results, no, there is something there. You can see that the hemoglobin is 100. Okay, and you can see this is type of microcytic hypochromic anemia. So is it related to his presentation or not, or his chronic diseases or not? You need to connect it, and you need to ask yourself what I should ask the patient regarding these microcytic hypochromic anemia. And then usually when I see a patient having anemia, I screen the other cell, other cell lineage. Okay, you need to look at the white blood cells and rapidly on the platelets for two reasons. Okay, if there is pancytopenia, so this is an alarming thing, you need to call the hematologist. If there is no pancytopenia, but there is reactive thrombocytosis or reactive high platelets, then you may consider that, yeah, there is some iron deficiency, there is something happening there, and then there's just the bone marrow trying to compensate by having a lot of platelets because platelets production doesn't need iron. Sometimes when you have hyperactive bone marrow, because you have anemia on the
mhm,
acute stage of anemia, not on the chronic stage of anemia, you may have the platelets high. So don't be misled if you find the platelet high in the exam or in real life and the patient have anemia, that this is a thrombocytosis case. No, it can be reactive thrombocytosis. Is not something alarming. And how you would know, if you treat the anemia, the platelets should decrease, okay, with the first 2 weeks from the treatment.
mhm,
So this is how I will think about that. I find that okay, renal function is fine, most probably stationary. He have chronic CKD, but then his eGFR is not low. Okay, maybe he have albuminuria, perhaps microalbuminuria. So maybe we need to do ECR before good to make it, perhaps. Okay, so these things you may open it with the patient. This is how you are connecting the patient condition and the blood test that presented. Is there is some blood test you need to be done and was not done, perhaps, then you can also address that in your management plan. Okay, cholesterol is high. Yeah, well, is he patient for starting statin? Most probably yes. He have CKD. He already have high Q risk. Most probably, and CKD need to start a statin with it. Okay, even if the Q risk is not high. So you may tell him, yeah, actually you need a statin. Yeah or no, Murtaza.
Right. Yeah, 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 I can hear you.
Hello?
Shall we? Yes, hello. Yes, can you hear me or no? Hello?
We
Hello?
Hello?
can hear you.
Can you hear me, doctors?
Yeah, we can. I don't know. Maybe you can anybody hear me, please? I think Salim
Yes,
can't
I
hear
can.
me. Hello, Salim, can you hear me? The other
Hello?
doctors can hear me.
Do you hear me, doctors?
Hello. Yeah, we can hear you. But I
Hello?
think, hello,
Do you
yes.
hear me?
Yes, we can hear you.
Islam, we can hear you. Yes, Islam.
Hello?
Hello, hello. Yes, we can hear you. Hello?
Yeah, Dr. Murtaza, do you hear me?
Yeah, we can hear you. I think
But I,
all of them can hear you.
so is everyone able to hear the recording that was how I talk, what I was saying? So, yeah, I don't know. Just 1 minute. I'm so sorry for that. I will just stop the recording and maybe I will.
If you could log out or log in, or I don't know.
Yeah, so let me just stop the recording.